Hello everyone. So today we are going to discuss management of different causes of falls. So here the first one that we have is postural hypotension. So in postural hypertension, you will start your management by explaining the condition to the patient. You will tell him that your blood pressure falls when you change your position from lying or sitting to standing and you experience dizziness and falls. This is called as postural hypertension. Now, what we are going to do for you today is we are going to admit you. I'm going to inform my seniors about your case as well. They're going to review your medications. If the patient is hypertensive already and he's taking more than one blood pressure medication, and you will tell him that we are going to review your medication of your blood pressure and we might change or adjust the dose. We will do some other tests for you. We will order routine blood tests and ECG, that is electrical tracing of your heart, and then you will give journal advice. You will tell him that you need to change your position slowly and gradually. Cross and uncross your legs firmly before sitting and standing. Drink plenty of fluids. Take small frequent meals. Avoid alcohol, etc. So this is your journal advice. Okay, so you are going to admit, you are going to review medication, order some routine investigation and an ECG, and give journal advice. This is the management of postural hypotension. Okay, the next thing is head injury. Okay, so head injury is not basically a reason of fall. It can be a reason of fall as well, but it's mostly a consequence of fall. Okay, but what you are going to do in head injury, you are going to either admit this patient or observe, depending upon the condition of the patient that we are going to discuss in a while. You are going to inform your senior. You are going to request some investigations, that is routine blood and CT scan of the head. Now, there is a specific criteria whether or not to order CT scan in cases of head injury. If the patient meets the criteria, then we order CT scan. Otherwise, we reassure the patient. Okay, and then you have to safety net the patient as well. Safety net about loss of consciousness, any repeated vomiting, any fits, any weakness in any part of the body. If the patient experiences any of that, then please return to the emergency department. Okay, let's discuss the criteria of performing CT scan. This is important because when you have a patient who has fall and present with a head injury, you have to ask these questions in your history taking to know whether you have to order CT scan or not. So this is important for you to memorize. Okay, so in cases of adults, you should perform CT scan within 1 hour if the patient presents to you and his GCS is less than 13. You don't need to perform GCS in this station, but because if you perform GCS, then it will take about 3 minutes. So you don't need to perform GCS. You might have been provided this information as well. So if GCS is less than 13 on initial assessment, if GCS is less than 15 at 2 hours after the head injury, okay, so GCS at less than 13 on initial assessment, and if on initial assessment it is 15, then if there is fall in GCS by 1 point or 2 point or any fall in GCS, falling GCS means deteriorating condition. Okay, any suspected open fracture or depressed skull fracture, any sign of base of skull fracture. So sign of base of skull fracture will be panda eyes, that is blue eyes, bleeding from the nose, or leakage of any fluid from the nose, leakage of any fluid or blood from the ears. Okay, any bruising behind the ear. So these are signs of base of skull fracture. Any post-traumatic seizure, any focal neurological deficit like weakness in any part of the body, more than one episode of vomiting. All right. So GCS information, most likely you will have been provided this in the in the question stem, because it will be difficult to expect to the candidate to perform GCS as well. All right. Then you will ask about any fracture, any skull fracture at all. Then you will ask about sign or base of skull fracture, any bluishness below the eyes, any leakage from the nose, from the ears, any bruising behind the ear, any fit after the injury, any weakness in any part of the body after the injury. Did you vomit? And if vomited, the patient has vomited, then how many episodes of vomiting? Okay, if it's one, then it's okay, but if it's more than one, then it means that you have to request a CT scan. All right, so any of these 7 points, if any of them is positive, you have to request a CT scan within 1 hour. Okay, now in which patient we have to request a CT scan within 8 hours. So So these patients you will keep under observations. You will keep under observation for 8 hours, and then you will request a CT scan. All right. So patients on warfarin. Okay. Loss of consciousness or amnesia. Loss of consciousness or amnesia, and any of these, if any of these is positive, like if age is more than 65 years, if there is history of bleeding and clotting disorders, if there is any dangerous mechanism of injury, like fall of more than 1 meter or 5 steps, if the patient was a pedestrian or cyclist and he was hit by a vehicle. Okay, if there is more than 30 minutes of retrograde amnesia of events immediately before the injury. Okay, so either if the patient is on warfarin or if the patient is more than 65, either the patient is on warfarin or the patient has experienced loss of consciousness or amnesia, and he is either more than 65, his history of bleeding or clotting disorder, if there is any dangerous mechanism of injury, if there is 30 minutes of retrograde amnesia, then you will perform a CT scan within 8 hours. Okay, so this was basically the criteria for adults. Now we also have a CT scan criteria in children that you also need to memorize. In children, it is different. So children means anyone below 16 years of age. Okay, so in children, you have to perform CT scan within 1 hour if GCS is less than 14 on initial assessment and less than 15 in babies under 1 year. So in adults, it was less than 13 on initial assessment, but in children, the criteria is more sensitive. It's less than 14 on initial assessment, and even more sensitive if they are babies under 1 year. Then if it is even less than 15 on initial assessment, you have to perform a CT scan within 1 hour. If GCS is less than 15 at 2 hours, sorry, this was 2 hours. Okay, so this criteria is same in both adults and children. GCS less than 14 at 2 hours. This is also the same suspected open or depressed skull fracture, but as these are kids, so you also need to add TENS fontanelle. Okay, any sign of base of skull fracture for babies under 1 year, any bruise or swelling or laceration more than 5 centimeter on the head. So you also need to ask if there was any bruise, and if yes, roughly how much was it in size. Okay. Now, within 8 hours, you have to perform a CT scan if there was loss of consciousness lasting more than 5 minutes. If there was any abnormal drowsiness, okay? If there were 3 or more discrete episodes of vomiting. So, in adult, it was 1 or more, but in kids, it's 3 or more episodes of vomiting, okay? Loss of consciousness more than 5 minutes, any abnormal drowsiness, 3 or more discrete episodes of vomiting, dangerous mechanism of injury. Dangerous mechanism of injury, the criteria is same, fall from a height of more than 3 meters or 5 steps or high-speed injury. Like vehicle hitting a pedestrian or a cyclist. Amnesia lasting more than 5 minutes. In adults, it was 30 minutes, but in kids, it's 5 minutes. Okay. Any bleeding or clotting disorders. Right. So epilepsy, if the patient gives a history of fall, but he tells you that there were fits, so it most likely it's a seizure. That now you can't say that it's epilepsy based on a single seizure. Okay, so you will just explain that I believe what you experience is called a fit. It's a temporary abnormal neurological activity in the brain. There are a lot of causes for it. There are many triggers like fever, etc., etc. You will explain. Uh, and then you can tell that it can also occur because of any unknown reason, and it runs in the family. In that case, we call it epilepsy. So what you will do, you will inform your seniors and you will refer urgently to the specialist. Okay, because we cannot, on a single episode, we cannot say that this is epilepsy. So of course we need to refer to the specialist. What the specialist will do, he will do an EEG and a CT scan. Okay, and if epilepsy is confirmed, then he will start on anti-epileptic medication. Meanwhile, you will give general advice while he's waiting for specialist assessment. You will give general advice on what to do if an attack happens. So you will tell him all the things that you need to, do not restrain the patient, do not put anything in his mouth, keep him in not left lateral position. Tell him not to restrain the patient. Remove everything that might harm the patient, like tight clothing and any jewelry around the neck, etc. Don't put anything in the mouth, and start observing the time. If the time of the attack exceeds more than 5 minutes, then you need to call an ambulance. And if after the attack, lie the patient in left lateral position, and yeah, so and bring him to the emergency department after the attack as well. So, and you will tell the patient to stop driving if he's driving, stop working on heights, swimming in deep water, etc. Okay. Stroke and TIA. So now stroke and TIA can also present with a fall. So if it is stroke, then you will explain you have an interruption of blood supply to a part of the brain. If it is TIA, you will say you have transient interruption of blood supply to a part of the brain. In stroke, we will admit the patient. We will do blood tests. There is routine blood test. We will do a CT scan of the brain, which is important to diagnose whether it is ischemic stroke or hemorrhagic stroke. You will do an ECG and you will do an echo because ischemic stroke can occur because of a clot from the heart and atrial fibrillation, okay, and embolus from the heart. You will inform your seniors if it is ischemic stroke, then you will do thrombolysis within 4.5 hours, thrombolysis with alteplase if the patient present within 4.5 hours, or thrombectomy, which is mechanical removal of the clot, which can occur up to 6 hours. Okay, you will control blood pressure and blood sugar. You will assess swallowing function, and you will assess hydration and nutrition and maintain the hydration and nutrition of the patient. Okay. All right. If it is hemorrhagic stroke, then the management is just like subarachnoid hemorrhage that I've explained in a previous video. I will briefly tell it now. You will admit the patient. You will just control the blood pressure. You will give nimodipine, okay? And if needed, then you will also involve neurosurgery for further procedure. Okay. In TIA is a transient interruption of blood supply. So you will request all the blood tests like the routine blood test, the ECG, urea and electrolyte, and CT scan of the brain, and also Doppler ultrasound of the carotid artery. Okay. Symptomatic treatment, you will start the patient on aspirin and blood pressure medication. You refer the patient to TIA clinic, and you will also safety net this patient. Safety netting about another episode of TIA. So you'll tell the patient if you have any slurring of speech, if you have any weakness in any part of the body, then please call 999 or come to the emergency department as soon as possible. So that was all about the management of different types of falls. I did not explain the management of BPPV and Meniere's disease because I'll explain them with ENT. All right, because I will explain how to take history of BPPV and Meniere's in detail, what investigations to order, and what to do, what is the management of BPPV and Meniere's. So I hope this was helpful, and I will see you with the next video.